Greetings. My name is Savannah Spells, and my project is on sickle cell disease. Sickle cell disease is a group of inherited blood disorders that cause abnormal hemoglobin production, resulting in rigid sickle-shaped red blood cells. As you can see from the picture, the top is a regular cell, and at the bottom, you can see there are some regular shaped cells, and there are also some sickle-shaped cells. What causes sickle cell disease? So sickle cell disease is caused by a mutation in the HBB gene. The HBB gene provides instructions for making hemoglobin, the protein, and it carries out oxygen. So these are some of the symptoms for sickle cell disease. Some of the symptoms include painful episodes, which are also known as crises. They can occur um, in the chest, in the lower back, legs, joints, and yes, things of that nature. Also anemia, which is tiredness, fuzziness, shortage of breath, shortage of healthy red blood cells, and things like that. And also jaundice, which is a yellowish color of the skin or whites of the eyes. Okay, so the medications that people with sickle cell disease take is like folic acid. And folic acid is like a daily medication. You usually take it in the morning. Um, it's a B vitamin that helps prevent severe anemia. Um, People with sickle cell disease also take ibuprofen. Ibuprofen is taken like when you're in pain, but you're not in terrible pain. So you usually would take the ibuprofen first, and then if the pain doesn't get better, you could take like um, hydrocodone or oxycodone, um, something like that. And I know after you take that, if that doesn't work, the hydrocodone, then that's when you need to go to the emergency room and they will give you IV fluids through the IV, and then they'll give you more like different kind of pain medications that you could not take at home or you couldn't get prescribed to you at home. Um, Voxelotor, that can prevent red blood cells from sickling, glutamine, um, which is kind of like ibuprofen and anti-inflammatory drugs, like stated ibuprofen. Usually also um, people with sickle cell disease, when they have a fever, that is also like a sign that you need to just go straight into the emergency room. Um, okay, next slide. You might be asking yourself, is there a cure for sickle cell disease? Okay, the thing is, they have two cures, the stem cell transplant and the bone marrow transplant. But those two things are very risky. And the only people that really qualify for those two um, procedures or transplants would be people um, who have sickle cell SS. I have sickle cell SC and I do not qualify for it. They usually want to take the people who are affected by it the most and, spend the most time in the hospital. And people with sickle cell SS, they have it the worst. So they're always in and out the hospital having to get blood transfusions and things like that. So that's why they would be qualifying for it. Who is mostly affected by sickle cell? So African Americans are mostly affected by sickle cell disease. Sickle cell disease occurs in every 1 out of 365 Black or African Americans. Okay, there are other races that have sickle cell disease, like Hispanic Americans. Sickle cell disease occurs in about 1 out of 16,300 Hispanic American births. Also, Middle Eastern, Asian, Indian, and Mediterranean descent and Southern European descent. Okay, the sickle cell disease pedigree. This is the sickle cell disease pedigree. As you can see, um, The two parents, okay, they are normal, and then the descendants of them. So with sickle cell disease, it's like sometimes it's a probability. Like my dad, he didn't have sickle cell disease and he did not have a sickle cell trait, but the type of blood that he had, it was like type A blood, or like he has a different kind of type of blood. And then my mom, she has a sickle cell disease trait. So there was a 25% chance that I could get sickle cell, and I ended up getting sickle cell. So I don't have any siblings. I am the only one who has sickle cell, but if they were to continue to have kids, it would still always be a 25% chance that their kids could have sickle cell. Okay, genetic testing options. There are different genetic testing options for sickle cell disease. There's a blood test, a hemoglobin test, molecular genetic test, prenatal genetic test, and pre-implantation genetic test. Most of these tests are like done with drawing blood. Pretty much all of them are done with drawing blood. Some of them, what they really look for is like the hemoglobin, like your hemoglobin count and things like that. So they're really looking in the hemoglobin for a lot of these tests. Is genetic testing required? Yes, genetic testing is actually required in the United States, and they test the newborns for sickle cell disease and sickle cell disease trait, the trait, within 24 to 48 hours of the birth. The test uses the same blood sample as other newborn tests. So they, like for newborns, they just test everything. And this is one of the tests that they do for newborns. Okay, these are my resources. And before I close out, I want to say that this project was very near and dear to me because I have sickle cell. I have sickle cell SC. So a lot of the things that I shared, like the medication, is from my personal experience, things that I take. Um, and yes, thank you so much for listening, and I hope you learned something. Have a nice day.